We're surrounded by conversations every single day. Chats with friends, discussions in class, and the constant buzz of social media. But what about the conversations that we're not having? These are the conversations about our mental health and how we truly feel. Have you ever kept your feelings to yourself? It's something many of us do, but here's the thing. This tendency to hide our emotions, to keep them locked away, is especially common among us kids. It's something I see all the time. One day, when my family and I were walking at a park, I noticed a girl from my dance school who was usually quiet and spent most of her time alone. She was sitting on a bench all by herself, tears rolling down her cheeks. I couldn't just walk away, so I approached her and asked, "Are you all right? Can I help?" She looked at me as if she wished I hadn't seen her like that, put on a fake smile, and left. But those tender tears on her face told me she wasn't truly okay. I wondered why she wanted to cover it up. I felt bad that she didn't feel comfortable telling me. Would she tell her parents? I didn't know if she felt safe enough telling anyone else. This wasn't the only time that I've seen a kid struggling with their emotions. One day, when I was listening to my teacher talking about quadrilaterals, my class heard a shrill scream. We all turned around to see an angry-looking classmate yelling. She lifted her laptop way over her head and then smashed it on the white tiled floor. The laptop shattered into a million pieces everywhere. It was such a shock because this girl was usually calm, but definitely seemed sad most of the time. Had she been holding in her sadness for so long that it led to this outburst? I wanted to learn more about this problem where children are facing mental health disorders but are not talking about it. This is a pressing issue globally. According to the World Health Organization, 15% of children and adolescents have a mental health disorder. Shockingly, 70% of them don't receive the needed help early on. These numbers show the urgent need for more awareness, support, and open discussions about mental health. Children are experiencing mental health issues because of the mounting pressure that they encounter. It's not just about the schoolwork. It's also about trying to fit in with friends, the challenges of the internet, and always trying to be their best at everything. I know, I understand stress. Currently, I have 2 hours of work after school every day, then I have basketball 3 times a week, and I take extra classes in dance and computer science. And I'm always trying to spend time with friends and family, not to mention writing and practicing this TEDx talk. However, it's important for us to not feel alone in this and to remember that it's not only okay, but it's essential to tell trusted friends, family, or adults who can help us feel better. Helping a child with their mental health is like a puzzle with many pieces. Parents can play a big role and can support their children by these 3 things. Number 1, listen actively. Give your child your full attention and avoid interrupting or jumping to conclusions. Second, be patient. If your child isn't ready to talk, respect their boundaries and let them know you're there whenever they're ready. And lastly, seek professional help. If your child is showing severe distress signs or mental health issues, consider involving a professional. It's also important for parents to show that they understand the stress that kids go through by doing fun things together and showing positive ways to handle problems like journal writing and setting goals. As I continued to learn about this issue, I was curious to know what I could do to help. I have loved technology since the moment my parents bought me a purple learning computer with all these fun games. It turns out There were activities to develop a child's brain, and I played with it every chance I could. Thanks to technology and AI, we have many tools and apps that can support children and parents in managing mental well-being. These resources offer advice on feeling better, relaxing, and how parents can provide additional support. However, a gap still exists because children often don't share their problems, and parents' busy schedules can limit their attention. But what if I told you about an idea that could bridge this gap? It's my AI-based mobile application that I'm currently working on that can use call, message, or social media data that kids use every day to identify patterns and bring any concerns to parents' attention. It tracks the history of every day so parents or mental health professionals can scroll through any time. This AI model recognizes mental health issues and buzzwords. For example, a kid might message someone, "Leave me alone," or "I want to give up," or "I don't want to talk about it right now," as well as a lot more serious ones like "I just don't want to live." The app will notify their parents. Though we have many tools and technology, the responsibility lies on children to talk about their feelings, and parent support is crucial. Let's create a safe space where children are encouraged to talk about their feelings, fostering resilience and well-being.